is the Emergency Medical Minute.
All right. I just have a quick one about, there was a study I was reading about that is interesting, and is if we don't have enough core measures to worry about between stroke stuff or cardiac stuff or anything else, there are some authors that are proposing that we get more concerned about our door to LASIX time. And so, furosemide is the more appropriate name. They were luckily, apt enough not to call it the DTF time. They just said, they had some other kind of acronym they were using out instead of DTF. But that being said, the studies that they're kind of citing or kind of looking at were the mortality and volume overloaded patients, CHF exacerbation, and the time that they got to LASIX. Now, I don't think we're going to see anything soon with this, but as we know, there probably is a benefit to getting that volume off early. But there's a lot of kind of flaws with this study, why it's not really truly applicable to what we do every day. The main study that they're looking at did show a definite benefit mortality. It was like 2.3% in the people who got LASIX early compared to 6% who people got LASIX later in their hospital course. So there's definitely a benefit there, and it seems like it's pretty statistically significant. But when you look at it, it doesn't really make sense. So the people in the early group were in the first 48 hours of their hospital stay. So that's a big kind of time frame, meaning as long as they got it within 48 hours, they're included within that group. And so it could have been mismanagement, it could have been misdiagnosis, or it could have been they got volume overloaded as a result of what happened early on. So, and then there's a lot of factors. I think the patients who get LASIX in the emergency department are in clear CHF exacerbation, volume overloaded. So of course we're going to be a little bit more aggressive with them. Whereas this mortality benefit, not really clear if it's only associated with that volume overload. So in any case, I bring that up. I'll keep this brief just because it may be one more marker in the future that we get to be timed on and looked at. I would hope they'd call it the DTF, but I don't think it's going to happen. But that being said, the door to furosemide time may be something that we have to look at. And, I think practically speaking, we all know that there's patients that would benefit from that. There's still other therapies that are just as important, such as ACE inhibitors or nitrates in those patients, that this paper didn't even really address that either. So in any case, that's a brief kind of update on that.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.